Good morning. Happy Monday. It's Dr. Mkono. Just doing a progress check. I'm going to have a very long discussion with you later on. I do need to edit a little clip that I have made for people who need more information on the topic of the role of breathing test. I just want to give you a brief TikTok, or shall I say short version, for the people who have no time to listen to every word I say, which by the way is super important. The breathing test or the lung test that we do, there's a few, but the most common one, even if it's just a little tiny miniature test that you do like a spirometry, or the breathing test, which is the full breathing test is what I would refer to, the pulmonary function test, is really to check your progress. So do me a favor, when you're doing a progress check and your doctor is issuing, I need a breathing test, clarify with them, are you talking about testing me to see if I have asthma? Because if that's so, they need to instruct you to get off the medications if that is what they're doing, right? But if we've already diagnosed you with asthma, and I'm talking about asthma, I will talk about COPD next, okay? Your asthma can be in and out. It's sporadic. For some people, it's there every single day. And the severity can vary up and down, right? But when we are meeting you for the first time, we're working you up for the first time, we're going to do a breathing test to test whether you have asthma. And that is a point that you need to understand. And so there will be instructions how to do that safely, okay? Because we definitely don't want you, if we've already put you on some medication, we don't want you to withdraw your medications and get a flare. And for those people who are doing it for checking whether they have asthma, diagnostic purposes, then they will instruct you to get off for a period of time. And they may say just take an albuterol, or, if all fails, you obviously want you to be safe. We don't want you to get really sick. You plan it out right before your test. And you do the test and you go and review with your doctor. And they make a diagnosis and give you an official plan for your inhalers. Now, going back to the other people that have already a regimen, maybe we have them on an inhaler once a day or twice a day, assuming you're using it correctly, of course, because it could be once a day, and if it's going to the air, obviously you're not getting it and it's pointless, and that's where it gets confusing. But let's say you've got this perfect technique because you've been watching my videos and you've really listened to everything I said, and I said technique has to be perfect, and you're holding your breath for 10 seconds and you're doing all the beautiful things I show every day, and you're washing your mouth after, etc., on those inhalers that require that. Now, your doctor says, oh yeah, you've been using your medication for maybe 2 weeks minimum, okay? Because 1 week is not enough for these inhalers. They're very mild. 2 to 3 weeks. Now they want to check how you're doing, point control, or maybe years later, they're checking it on a yearly to check whether you are still controlled, right? Please be sure that you're on the medications exactly as prescribed, because we may be adding medications if it's not controlled on the test. We may be reducing medications if it is controlled. So we want to make sure we know where you are, okay? And if we don't, then it's completely, I would say, for me, I would think it's a waste. If I knew that you were going to get a test, I already know you have asthma. Once we find you have asthma, excuse me if I'm wrong, but you always have asthma, okay? It just may be dormant. It may be kind of, sleeping. But when he wakes up, especially now, we are in season now, colds begin, you get sick, it's going to flare and show its true self. You know how it is. With those people who can pretend, later on you see the truth, right? So, I mean the asthma, okay? So I want you guys to know that once we are testing you for control, that you have gone and really, if you had stopped using your medication and your doctor is issuing, do a test, go back on it, let them know, hey, I haven't been on, but I'm going to get back on. And I'm going to make sure that the test reflects what we are on right now, the regimen. If it's twice a day, it's twice a day. If it's once a day, if it's once a day. If it's 2 inhalers, it's 2 inhalers. If it's 3 inhalers in one, it's 3 inhalers in one, and you're doing it daily if that's what it is, or twice a day if that's what it's prescribed. And then you do that for 2 weeks. If you were off, like you were being a bad patient, you get back on being compliant and then test, because that's what we're doing. We're checking control. And if you're on a biologic or other medications to help, with your asthma, you would be back on them perfectly with the perfect technique and then test. Then that's a really good test. It's going to be valuable to you and your doctor, because it's going to say, hey, on this regimen combination A, you are controlled and let's see you next year. Or, oh no, on this regimen B, you're not controlled. Now I need to add this medication. Now I need to cross-check your technique. Is there something wrong with your technique? Or maybe you couldn't afford that medication, so you stopped taking it. Okay, fine, thank you. Let's get back on that. And then you're going to correct it. And then, of course, you're going to have to get another test because we need to check whether that's controlled. But we usually give you time. I hope I didn't go too fast, and if I did, slow it down. But I just wanted to give you a brief idea what that test means. It's really checking progress, checking whether you as a patient are controlled on a particular regimen and combination and strength to match your severity on your breathing test. And if it's your first time, then obviously we don't know. And that's how we're going to use that test to see how severe you are and whether we need to prescribe a medication that has one medication inside, two medications with or without steroid inside the inhaler, or whether we need to give you prednisone because you're having a flare and now we then rediscover what your regimen is like, etc. So it's used to gauge how you're doing. When you do this test, don't get nervous. I know it's so easy for me to say, but it's really just prepare to give it your best effort so we can use that information to help us guide you and get you in a better place. Less interruptions, less admissions, and that is the whole goal of us controlling you. Okay? I hope it's been an informative clip, and I wish you a happy Monday, productive week. And yes, look me up because I will try my best to get back into the lives. I have been super busy, but I want to make time for you guys again so that we can try to get everybody back to control. And they get to ask me questions. I know some of you are shy, but do me a favor. The most valuable information actually lies on those questions because they actually prompt me to giving you guys more videos. And I just want to wish you guys a happy Monday and all the progress. And just hope that this video helps you guys clarify why you're doing the breathing test and how you could use it to help you win asthma. And for the COPD, it is truly to check your progress if you're getting worse. So if you're a smoker, I would recommend you stop smoking, and we can help you not get worse, right? And we can also show whether you have asthma or COPD on your COPD test and help you control your symptoms and at least make sure that you are getting the best out of the medications as far as control is concerned, because COPD is usually permanent damage. Asthma can be reversible at first. Later on, it can also cause a permanent damage. So we are hoping that we catch you early and get you breathing better. I hope I didn't give too much information, but gave you the basic idea. In summary, breathing tests are for you and for your doctor to help you guys decide whether the regimen you have is correct, or whether or not you have asthma or don't for the first time, right? And if we already diagnosed you with asthma, we are not trying to retest you each time. So please be compliant and please check with your doctor whether they plan to test you on or off medications. And if it's off, to give you guidance so they keep you safe. I wish you all the best. Take care.